Message from your community nurse Martin. This week I'd like you to do 4,000 steps each day using your new pedometer. Good luck. Martin has signed me up to a gym. Here I am walking with my friends. Well done, Ken. You've done 25,000 steps this week.
The app gives us that opportunity to be able to work with individuals and help them understand very clearly what health concerns we have for them, and helps them monitor and to be in control. If you present the information in the right context, in the right way, people can understand and can get involved in their health care.
Yes, we've been really excited about this development, and we've been involved right from the beginning really with the trials. There are so many different ways it can benefit people, and I think one of my real examples I like to think of is when I was a community nurse, is somebody that was really scared to go to the dentist and could articulate why she was scared, articulate what her problems were when she wasn't at the dentist. So actually using the app and being able to video, being able to prepare for something, and being able to, and then that prepares the dentist or the doctor or whoever that you're seeing, that you've got something that is there, readable, really easy to use, and the client doesn't feel anxious and they get the story across.
It's using the mediums that the people that we support are increasingly more interested in, and therefore, you know, that they themselves are really keen to move away from a green file and a blue file and a pink file, but actually have something in their pocket, in their hand. You know, even if it's not actually, for some of them, held by them, but held by their parents, their families, their carers, their friends, their relatives.
Yeah, we're primarily working with two people. One, a young lady who lives independently and has lots of experiences with technology, and another older chap who has spent his life in lots of different services, residential and long-stay hospitals, etc. So two people with very different life experiences. They both use it in very different ways, but essentially what they've done is we've helped them use their own voice, is to share what they feel is important to them and their health, rather than us telling them what we think is important. And I think the emphasis is very different. And what we've found is that looking at the things that they think they're very important and really working with them and supporting with that, we've found that they're more willing to work with us, more willing to accept support and work with us to a positive benefit for themselves.
One young lady has quite complex epilepsy and some mental health issues. We've used the app as a kind of communication passport. So within this app, we've put a box for her epilepsy to explain the different types of seizures she has. Another box has her epilepsy planning and the emergency medication she requires if she has a seizure. We would like to, because she has complex partial seizures, which can be quite unusual behaviour, we would like to video these so that other people can recognise what they look like, because they can be very easily missed. She has some quite complex mental health issues as well, and she's found particularly useful that she's put in, and she did this herself, it was her own idea, to put in a worries box. So as she goes through her day, if there's anything particular that's bothering her and continues to bother her, she can write it in her worries box, and then when she goes to see her worry doctor, her psychiatrist, she can show him what she's written.
You've been helping us to try out the app?
Yeah.
And you met Lorenzo?
Yeah, he's a good guy.
Do you want to say a little bit about what you've been doing with it?
Text.
What have you been writing about?
Key worker.
Yeah.
Groups.
Been putting down about the groups you're in? Yeah.
And one-to-one on the weekend.
Right. You made some boxes, didn't you, on the app?
Yeah.
Yeah. And did you find that quite easy to do?
But yeah,
Yeah.
it's really excellent.
It was excellent.
Yeah.
So once you got started, you found it quite easy.
Yeah.
I've already identified quite a few service users that come here that we could use it from a health point of view, but we've identified lots of uses for this app outside of health as well.
It can probably take, in the long term, I'd like to see it taking over a lot of the things we do, because it is more live, it is owned by the person rather than the clinician, and it can be adapted and changed as needed. So I think at the moment I think it enhances what we do, but I can see in the long term that it takes over some of that bureaucracy.
The app for me has got unlimited opportunities. It really will help put people with a learning disability and their families and carers in control of their own health, and expand into their health and their well-being.
We would love to see everybody that comes to us with this app. What we want to see is what people really think is important for them. We want them to have real empowerment over their lives and make choices for themselves rather than for other people.
So how would you rate the app? How good do you think it is?
Thumbs up.
It's what?
Thumbs up.